Okay, Paul, so we're at the point where we're gonna look at your shoulders, and then we're also gonna, do some neurological testing and positional testing. So at this point, I just wanna look at your shoulders. Things are symmetrical, nothing's uneven. Any shoulder pain?
No.
Okay. Can you move your shoulders up for me? And down, forward, back. Can you push my hands? There you go. So he has +5 muscle strength and full range of motion in his shoulders. The next thing I want to do is I would ask him to walk across the room at this point to look for his gait. I watch him walk every single day. I know that he has a steady gait, which is aligned. So I'm not going to do that at this point. We're going to do a pronator drift. So what I'm going to have you do is put your palms up, and I'm going to have you close your eyes. Okay, perfect. So there was no sway, and that was a good result. The next thing we're going to do is a Romberg. So where I'm just going to have you stand still, and I'm going to have you close your eyes. And at this point, I would make sure that the patient doesn't fall, and I would make sure that I'm standing here. I have based him across the table in case anything happens. And that's a good response. Thank you, Paul. So the last thing we're going to do is I'm just going to pull this out and have you sit. We're going to do an eye exam. If you could sit for me. So in my office, we use, we're going to do a Snelling test. In my office, we use these as our cards. What I'm going to do is I'm going to have you hold it way out for me for about 6 feet. I can actually hold it for you. So we're going to go about 6 feet, and with both eyes. He does wear glasses. He cannot, how is your vision without your glasses?
Terrible.
He cannot see without his glasses. So from 6 feet, tell me which line you can read. Can you read the bottom line?
It looks like DEFPOTEC.
Perfect. And can you cover one eye for me?
DEFPOTEC.
And the other, please?
Same.
Okay. Paul, can you tell me which colors you see?
Red and gray.
And although this one doesn't have the distance, you would be able to tell depth perception by which line is longer. So this one does not have that, so I cannot ask him that. But that was certainly something that I would check. And my Snelling chart also doesn't have a lower line for me to ask him, but I would start at the lowest line and then move up. So your vision on the Snelling chart is 20/20. Paul, I want to thank you for helping me.
It's been a pleasure.
You've been a great patient, and thank you very much.